So, all right, let's get started. So welcome everyone and good afternoon to the informational session for the attachment vitamins funding opportunity. So just a quick round of introductions of the CARE team that will be here speaking this afternoon. So my name is Lena Zara, and I am the Project and Operations Senior Coordinator with the International Rescue Committee and CARE. And I'm honored and delighted to be joined by Jess Stalpy, who is our Senior Technical Advisor for Safety and Wellness and is the Project Director for CARE.
Thanks, Lena. And hi, everyone. Glad you're here with us.
Thanks, Jess. So just a quick kind of overview of what we're going to talk about this in the next 30 minutes. So Jess and I are going to give a quick background to CARE, to attachment vitamins, and what you can expect in terms of the pilot funding opportunity. We'll save and make sure to have time at the end for any questions that you might have. So please keep them in mind. We've been having it be a bit informal. So towards the end of our discussion, when it's time for Q&A, feel free to come off mute or feel free to also drop any questions in the chat. We'll be looking out for that. All right. So apologies if many of you are already familiar with CARE, but don't want to make any assumptions. So just a quick background. So CARE is the Center and Adjustment Recovery Center for, and is a 5-year project in partnership with the National Child Traumatic Stress Network and is funded by the Substance Abuse Mental Health Services Administrations. So CARE's goal is ultimately to ensure that forcibly displaced families, so that would be refugees, asylees, and asylum seekers receive culturally responsive, evidence-based, and trauma-focused treatments and service interventions across a wide variety of systems to ultimately to prevent and mitigate the negative impacts of childhood traumatic stress. So CARE's work focuses on providing quality mental health and psychosocial support services for children and families who have experienced forced displacement by acting as a bridge between community-based refugee immigrant providers and mental health providers. Now, CARE's aim is that people and agencies providing these services are trauma-informed, culturally appropriate, and guided by best practices. Our team of experts achieves this through training and technical assistance by leading pilots of culturally accessible, evidence-based interventions with and alongside our community partners. Now, going more into what the overview of attachment vitamins. Attachment vitamins was developed by the University of California, San Francisco. It is a early prevention program based on child-parent psychotherapy. Now, this is especially key for highly burdened families that wouldn't be able to participate in intensive interventions otherwise. This helps support parents and caregivers to ultimately learn about childhood development and impact of stress and trauma. We ultimately are looking to reflect on the child's experiences and possible meanings of the child's behaviors and promote secure attachment and safe socialization practices. Now, it's not attachment in the traditional sense, and it is not a parenting skills group. However, this is a group meant to provide some instruction on attachment and encourage parents and caregivers to find ways to integrate that knowledge and into their parenting to ultimately promote strong, positive relationships. Now, the ultimate goal and reflections are to increase caregivers' confidence in their ability to care for their child, particularly in the context of chronic stress and or trauma, through the following interactive activities and reflections. So ultimately to promote attachment, increase caregiver confidence, and promote also warmth towards the child. Now, this will be 10 sessions of curriculum content. Now, these can be done individually or in group settings. So it could be via virtual video conference or at an agency. The topics, which I just briefly introduced, include but are not limited to child development, impact of trauma and stress, and how trauma and stress may impact child behavior and the child caregiver relationship. Oops. All right. Well, now I will pass it on to my colleague, Jess, who will go into more details about what you can expect through the funding opportunity, more specifics regarding participant backgrounds and objectives, and then we'll finally close out with our Q&A. So without further ado, I'll pass this along to Jess.
Thanks, Lena, and hi, everyone. So just want to briefly go over kind of what the expectations are, what we're really looking for in partners for this piloting project. So as Lena had already gone over, we're really looking to implement at least one cohort of attachment vitamins, ideally in a group format, through this pilot within each organization that does apply. So I think in the funding opportunity, the announcement that we put out, you all probably have seen, we're hoping to fund at least 5 organizations. And so hoping to have you all who do get funded to be partners with us in recruiting 8 to 10 participants for the implementation. If you feel like you are able and willing to do more than one group cohort, we support that as well, but want to make sure that we're doing at least one cohort with caregivers of children who are under the age of 6. So that includes obtaining informed consent for the participants to be a part of this project, and making sure that we have strong recruitment protocols. As I've mentioned a few times, and Lena had mentioned as well, we really view this as a partnership opportunity, and for better or for worse, hopefully for better, you all will find, we as CARE and also UCSF intend to be really active in supporting the organizations that we work with through all steps of this pilot project, because we want this to be a collaborative learning experience, both for CARE and UCSF, and then also for the organizations that are a part of this pilot. So if you are one of the pilot organizations, you will have a lot of support through this. We promise we will not be overbearing. We want to really make it as collaborative in a positive sense as possible. We also, as part of this, because it is a pilot project, we will have measurement and evaluation requirements. And so those are part of the project currently with attachment vitamins. As we are implementing and using it, we have a few standardized measures that we are using with participants as both pre and post measures. Any of the organizations that are a part of the pilot will receive training and support in administering those standardized measures. And that is part of the agreement as part of this process, making sure that we're conducting those pre and post interviews with each of the participants. We also have some qualitative aspects of the M&E around surveys, and then also some process-related monitoring and evaluation for really learning about how this implementation goes. We also have kind of different participant materials. So we have, oh, I see we have a question, Melissa. I'm going to try to answer some of these questions as they're relevant and coming up. So I think, Melissa, that's a fantastic question. Right now, we are using the tool to measure parenting self-efficacy, TOPSY, the Parent Reflective Functioning Questionnaire, PRFQ. Q, and the Kessler Distress Scale. They take about an hour to administer as we are administering them verbally, and kind of walking through them with each client. They are translated in a number of languages, and we are actively in the process of translating them into additional relevant languages, and will make more translations once the partner organizations are selected, so that we have all of these measures translated into the appropriate languages for those clients who are literate, and also for staff who are administering them in language. That answer your question, Melissa? Let me know if you have a follow-up to that. Okay, that was a good one. And so with that, right, we have participant materials for any of the organizations that we'll be partnering with. We will have materials that need to go out to the participants to help facilitate the groups. We have added in here, as part of the funding, suggestions to budget in tablets for participants, especially if you are planning on implementing remotely. A lot of our experience with attachment vitamins thus far has been remote, given the pandemic context. That is not a requirement, however, to be facilitating remote groups. It's really dependent upon your organization's comfort and the way that you are delivering services and doing so safely within your communities. We also are asking for kind of having 2 identified attachment vitamins facilitators. So at minimum, we'll have 2, ideally 3 staff members from each organization be a part of this project in a very hands-on way. So going through training, we have a remote training that we are planning for October of this year as we get started. So we will have all of the attachment vitamins facilitators go through a 12-hour training. It's over, a 12-hour remote training that is self-guided online, and then a half-day, week-long half-day trainings. So 20 hours of training. I know that sounds like a lot on Zoom. Promise, it's actually quite fun. And we will have that opportunity, and we want to have both facilitators present to have that training. The bonus that I do want to say is that any facilitators that go through the training and then also participate in the consultation calls that we will have as part of this pilot will, at the end of this pilot project, be certified attachment vitamins facilitators, which means that they will have the credentials, they will have the ability to then go on and facilitate attachment vitamins groups on their own without any oversight from UCSF or CARE. We are still here to provide support beyond the pilot project, but our goal is for this to be not just that pilot and kind of funding for this short amount of time, but building some of the organization's capacity to sustain this work by having trained staff members beyond the project period. And I'm seeing we have some questions. Will facilitators co-facilitate? Yes, we do require that the groups are facilitated by at least 2 facilitators, ideally no more than 2, just so that there is an adequate balance of participants and facilitators. And ideally, we would like for facilitators to be bi or multilingual to be able to facilitate in language. So we know that's not always possible, and interpretation sometimes is necessary depending upon the language you aim to have in your groups. For interpreters, we can talk a little bit about that depending upon the organizations that are funded and if interpreters will be used. We have had some interpreters go through the training before, and it's been really helpful for them to have a good understanding of the project itself and to have that additional professional development if it's something they're interested in. And yes, I see, Emily, a great question that you have here. Can one of the staff identified be a cultural broker and non-specialist alongside a licensed clinician? Yes, 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 and yes. I also do want to point out that the facilitators do not have to, neither of the 2 facilitators have to be a licensed clinician. We do want to make sure that there is some oversight and support from someone with a mental health background, but we have had groups facilitated by 2 non-specialists specialists who don't have a mental health license or a specific mental health background. We do just require that there is that additional support within the organization, so that, as Lena had explained, attachment vitamins is really based on child parent psychotherapy, CPP. And it is really meant to be a lighter touch kind of entry point into more advanced or more intensive mental health supports if that is needed by participants. So it's meant to be a more accessible way for parents and caregivers of young children to get that support around strengthening attachment in the context of chronic stress and trauma. And Carmen, another great question about other professionals who provide IECMH, not sure what that acronym is.
Infant and early childhood mental
Ah,
health care.
Amazing.
Sorry.
Thank you, Carmen. It's like I learn a new acronym every day. It's wonderful.
Sorry.
Yeah, other professionals are definitely welcome. And that's something that's just important. We just want to make sure that when we have these groups and we're piloting them, that there is a clear entry point, and clear kind of referral procedures in place for a higher level of care if that's desired and needed, and that there are escalation or crisis protocols in place if there are concerns that are expressed in the group. For example, suicidal ideation, or any other mental health concerns that might be expressed in the context of the group. We want to make sure that there's that support locally within organizations and offices to be able to provide support not only to the facilitators, but also to the group. That makes sense. These are all fantastic questions. Y'all are great. Thank you for keeping them coming. And so that is what we are expecting of our facilitators. So we will have a lot of training that is a part of this. I truly, I know I said that the training is great, but I have gone through it and I facilitated it myself with a number of groups. And it has been an incredibly enjoyable, highly interactive training. We've had facilitators go through the full 20 hours and then say, we wish this continued next week because we've enjoyed this time in this space together so much. So it is a lot of time, I recognize, but there's a lot that is gained professionally. And I think for a lot of the facilitators, personally, for those of us who are caregivers of young children. We also will provide additional kind of technical assistance throughout the project cycle. So again, we will be partnering very closely. And then just a little more on the funding awards and kind of restrictions, of which there are not too many. But as I'm sure you all have seen in the call for proposals, we have individual awards that will be up to $25,000 US for each interested organization. And what we are really asking is that organizations are taking into account participant materials as part of their budgeting. So if any of you are hoping to do groups that are remote, making sure that there is an access to a tablet so that we can facilitate remote engagement for participants, making sure that we have some funding, involved for any program materials, right? There's printing of participant manuals. Sometimes we have welcome kits. The attachment vitamins curriculum also has a reading component with books. So having some funding in there for participant materials. Again, we don't expect you to know what all of those participant materials are, but just to be able to have that in your budget reflected, that there is some funding set aside for that. Of course, staff time for facilitators. And then we encourage having, if it is appropriate within your organization's funding structure and the way that you implement programs, some sort of incentive or an ability to pay for things such as transportation or childcare or wages lost for participant surveys. So as that great question we had earlier around, I think Melissa had asked the measures for the pre and post surveys, right? That does take time, and we want to make sure that we are doing our best to facilitate the participants going through the surveys and really wanting to honor their expertise and the time that they're taking on that kind of additional piece of the group. Right. I think that is it on this slide. We're going to move to the next one, but keep the questions coming. This is the last, I think, like major information slide that we have. So I promise there's not too much more that we have to talk through. We have, so just a little bit on what attachment vitamins is and what we're expecting in terms of participants and organizations. And I see we do have a chat. I promise I'll get there. But for participants, as I mentioned, participants in the group are parents or caregivers of at least one child under the age of 6. They are US-based families, so we are implementing this in the United States, and families that have experienced forced displacement. We are not restricting this to any certain immigration status or any particular nationality or region, really just focusing on that shared experience of forced displacement. We are hoping that this will support, of course, culturally and linguistically diverse families who have had that experience of forced displacement. Within most of the work that we do, we encourage that groups are one language. So having that ability to really facilitate in one language or have interpretation in one language for the groups. For organizations, we are seeking to partner with US-based public entities, private nonprofit organizations, or if you're affiliated with a government agency, that works as well. We are hoping to see a history of managing similar projects in terms of participant recruitment, implementing projects, and being able to manage funds. And then, of course, we are looking for that localized collaboration and coordination and hoping to provide that. We really, as I know I've said many times, want this to be a collaborative partnership among all of the organizations that are funded, as well as CARE and UCSF. I see we have a few questions that maybe I can answer real quick, if that's all right, Luna. Sorry, I know I'm holding this up. But I see, Melissa, restrictions on indirect, great question. So normal federal kind of requirements apply. So indirect costs of 8% is what we have in there. And apologies for us not adding that into the call for proposals. When there are things that we're new to this as well. This is something that we're excited to begin doing. So if there are any issues with that, we will also have kind of conversations with organizations if there is a concern about indirect costs that are submitted. And Emily, could a cohort of 8 to 10 participants include smaller groups for different languages? Yeah, that's a really great question. I think we've seen a number of different things and are willing to work with partners on really designing what these groups look like. I think generally, as I'm sure you all can attest to if you've been doing remote groups, that remote groups tend to be more successful when they are smaller. So having around 5 group members seems to be the sweet spot that we have seen from our experience. And so that might be having 2 cohorts that are remote. I think one thing that we want to be mindful of is just that with attrition, right, we tend to lose at least 1 or 2 participants due to life circumstances. We've had a number of caregivers in groups enter pregnant and have to end their participation partway through because they've given birth. And so really wanting to just be aware that we don't have cohorts that are very small to start off with, and then that leaves us with a group that is only of 2 participants if those participants don't have a great strong kind of chemistry and relationship that has been built throughout the group. So sorry, Emily, that was a very murky answer, but that's yes, and that's something we'd like to discuss and see what makes the most sense for each organization that's a part of this pilot. We recognize that everyone who is applying and everyone that we will work with, y'all are experts in the work that you do in your organizations, in your communities. And so we are definitely open to adjustments, to flexibility, to wanting to figure out how to make this work and be the most successful pilot that it can be for each of you. Melissa, yeah, a melt rate of about 25%. And so that's important to take that into consideration as we start recruitment and as we're initiating some of these groups and part of your project plan. Thanks for sharing that. Carmen, an organizational assessment as part of the application. Yes, IRC will be doing an assessment as part of our selection process, as part of the partnership process after we select the organizations that we will be partnering with. Our revision process will be blinded, and we will have a panel of reviewers that are using the rubric that we did share as part of the expression of interest, or the call for proposals, excuse me. And so we will then be partnering and going through some partner assessments and conversations with the selected organizations starting in August. But I'm going to pause. I think those are all the questions so far. Sorry, Lena, I'm getting ahead to the Q&A part. But if you want to, we can go through the last few slides to make sure everyone has the final important information.
No, this is all great. Thank you so much, Justin. Yeah, thanks everyone for sharing these really great questions so far. Really, just as Justin mentioned, the last few slides are just kind of reminders and a quick wrap up, and we can definitely get back to the Q&A. So just as a reminder that submission of the applications of the proposals will be to our email address. So after we finish these last few slides, I'll be sure to share a few things in the chat. Specifically, I can reshare the CARE email address. We are looking for a deadline of Wednesday, July 20th at 5 p.m. Pacific, and we're hoping to get back to selected participants and partners, excuse me, by Friday, August 5th. I will also be resharing the link to our request for partner applications document, the proposal guidelines, in the chat shortly. You may hopefully have seen this come through, but just in case, I'm happy to, we're happy really to share this once again. All right, so I can stop sharing my screen, making it a little bit more of a conversation and out of presentation mode for any other questions that are coming through, which again, it's so great to see the questions come through.
And if anyone has any points that you'd like clarified, if we didn't explain it, you know, in a way that was helpful for you, please feel free to re-ask or also be able to come off mute. We'd love to hear your voices. And Melissa, 8% ICR.
Will, so for incentives, because you're funded through the SAMHSA NCTSN, on incentives, are we following SAMHSA's guidelines?
Yes, yeah, Melissa.
Okay.
So we're getting a little, we'll get creative in how we frame what the incentives are.
Yeah.
But yes.
but what I'm asking is, we're falling under the same guidance that SAMHSA would ordinarily give regarding incentives and other budgetary pieces.
Which is usually $25 per kind of touch point that we have, which is why we were hoping to budget in about 50 for each pre and post. Does that make sense?
Sure.
Yeah.
Yep.
Yeah, and we are still learning a lot of these ins and outs as a new NCTSN SAMHSA grantee ourselves. So also welcome any pointers or creativity that anyone might want to offer. We don't have any more questions. I just want to thank you all again for taking the time out of your days to be here and to listen and to, oh, thanks, Melissa. We were just told 25, so I will double check that. But thank you all so much for being here, for your interest in this project. We look forward to hopefully receiving proposals from you all. And hopefully, even if we do not receive proposals from you, if you decide this is something that isn't right for your organization at this time, we hope to hear from you and to be able to partner with you in other ways in the future as well. So consider this you knowing us and the open invitation to reach out at any point. Lena and I and the rest of the CARE team are always happy to have conversations and provide support in ways that we can outside of this project.
Thank you.
Yeah, thank you, everyone. And just to say, to add on, just thank you so much. I did share a few resources and information in the chat. I know people probably are moving along to the next meeting, but just in case, our email address is in the chat, the link to the proposal guidelines, and also you'll find that our sessions are recorded and uploaded to the YouTube channel. I also shared in the chat. And we're also planning to share questions and kind of consolidated Q&As to those who have registered for our sessions as well. So thank you again, everyone, for your time this afternoon. Really great to have you and much appreciated.